Hello Bio4 and welcome to the lab section of vessels of the cadaver. We're going to go through all of those and I'd like you to have the list of the blood vessels in front of you, and we would start out with the veins. But first let me show you, this is kind of a diagram that you would see if we had to study all these different arteries, and luckily for you we don't. These are the veins, and it'd be interesting to actually map all these out, correct? But we're only going to look at the greater ones, the larger ones. So if we start out with veins of the thorax, this got cut off here, so this is veins of the thorax. We have the superior vena cava, so you can see, change my mouse again, the superior vena cava is the first one that we have right there. And the brachiocephalic veins. I'm going to change the color of my pen for it to be black. Okay, so brachiocephalic, I had explained to you, is something that is either draining from or going to, in this case, draining from the head and the arms, brachiocephalic. So brachiocephalic veins then would be here and here, correct? Because they are draining from the arm and from the head and from the arm. So those two sections would be brachiocephalic veins. External jugular vein is the one that goes up to the head. You know that? It comes along your neck. So that would be the external jugulars. Here and here. Okay, and then we move on down to the subclavian. If it's subclavian, it means it's under the clavicle. So this piece here that's coming under the clavicle and on the other side, now part of this bit coming under the clavicle here is going to be the section, then we're going to surround this like this, called the subclavian veins, right and left side. And we can't see inferior vena cava right here. Okay, I'm going to move on here. If we just draw it out like this, and this is going to be one of your assignments that you have to draw out in many of these veins and arteries, you would have then the superior vena cava draining from the left and right brachiocephalic veins, correct? And they would be going up to the head, the left internal and external jugulars. On the previous drawing, I only showed you the external. Hard to find both. Usually we find the external more visible. This is deeper. And then continuing on would be, again, under the clavicle, subclavian. And then it would continue on, now changing its name to axillary because it's in the region of the axilla, to then become brachial because it's in the region of the arm. Let's follow that again. Superior vena cava, left brachiocephalic because it's draining from the arm and from the head. As we continue along, it's going to change name. It's going to be under the clavicle, so it's subclavian, under the axilla, axillary, and then in this region of the arm, brachial. And that is symmetrical. It's going to happen on the other side too. And the two that went up to the head are the two jugulars, external and internal jugulars. Okay, I like the veins because it's symmetrical. What happens on the right happens on the left. That is not true of the arteries, which makes it more complex. So let's move on. I want you to draw these. So if you start out by drawing just one superior vena cava and a branch, and start from there, and then add on a few more and see how they're symmetrical, and then maybe add on more, and that's how you're going to go building your drawings here for you to learn them. Here there's a picture of a cephalic vein. So I had shown you here subclavian, axillary, and coming down to brachial. But another very superficial one that we see quite easily on our own bodies and that we can see on the cadaver quite easily is this other one that comes here, and that is the cephalic vein. I'll show that to you in the next. And here we go. Because it's so superficial, the hand and the arm, it's quite visible, more visible in some individuals than others. But there you go. Would be a dissection that shows the cephalic vein. And you know all these muscles now already, so that's exciting. Okay, in the abdomen now, we start out with inferior vena cava. So we're gonna move down now, down into the abdomen here, and this is the inferior vena cava. So this is draining right from the legs, bringing things back up into the right side of the heart. So we're going to expand on this drawing here and see what happens. And there we go. So this is inferior vena cava, right? So this is draining up. And we have branches that are to the kidney. We come down here into the pelvic region, and it's going to be receiving blood, oxygenated blood from both limbs. And so we need to learn these names. I'm going to start from the bottom here. So this is an external iliac, the one that's coming down the leg. And it branched from another one that goes deep down. So you'd have a dissection where you'd have to actually really sort of carve this one out. And this is the internal iliac. So internal iliac came more, it's not only internal, but it's also deeper. And they're both branching from a region called the common iliac. So common iliac is coming into internal iliac and external iliac. Just remember your bone here. This is an iliac bone. So that makes sense to name it according to the region that it's in. Another very evident one here in the drawing is the big vein that's draining from the kidney. It's the renal. And then we have, this is not visible, so I'm not going to show you that right now. Okay, I'm just going to show you the ones that you can see on my drawings. This is common iliac, external iliac vein, and coming deep and more centrally here is internal iliac. Common, internal iliac, external iliac vein. And we'll look at the arteries later. When we look at it in the cadaver, there you can see the renal vein. Very pretty. They've stained it so that you can see it quite well. This would be the artery coming down. So let's not look at that now. This is here. So this is coming up towards, right, draining this. And here it has the branches, this is draining also from the kidneys, renal veins. These are the hepatic veins, so in blue, what's draining from the liver, hepatic. Veins of the lower limb. So in the lower limb, we already mentioned the internal iliac, and then we need to see the femoral. So femoral vein and greater saphenous. So let's see if we can link those together, because that's going to help you more. So here we had external iliac that's going to become the femoral vein. So let's do it backwards, right? Because it's draining. So femoral vein, that's going to become then the external iliac. And then also another separate branch here that's much more medial. So think of it as more medial, draining also from the leg, is the greater saphenous vein. So remember to distinguish those. The more medial one is the saphenous, and the femoral is more sort of centered down the femur. Gonadal veins. So these are the testicular and the ovarian, and these are going to be draining up either from the ovary or from the testicle. And on the left side, it's coming in and draining into this that's called the renal vein. And on the right, it actually comes through the inferior vena cava. It's funny that that is not symmetrical. So you're seeing it here. In this case, it's ovarian, and you're seeing renal vein, and this is a left ovarian vein coming straight from the ovary, and on the other side too, but this time it's coming from or draining into the inferior vena cava and not into the renal vein. It's always weird when it's not symmetrical. There are the renal veins again. And then we're going to start with the arteries. So let's stop this video and do the arteries in the next one. Thanks for checking in. Bye-bye.